With breast augmentation, there's a few decisions that we have to make together to be able to pick out the best options for you. Now, the first choice we talk about is breast implants and what kind of breast implant we want to use. Now, there are two main categories of breast implants. There's saline breast implants and silicone implants. They both have benefits. I would certainly say that most patients at this point in time choose silicone breast implants, but occasionally I have patients who still have a preference for saline. Now, when it comes to picking the size of the implants or the style of the implants or profiles, a lot of people want to get really stressed out and worried about those things. I don't want you to worry about that. What I like to do is I like to be able to talk with you about what you want to look like and let you describe that to me. It lets me be able to help make an idea about what size of implant might be right for you, and then I base a lot of the other decisions that have to do with those things just based on your body and your measurements. Now, when it comes to the final decision about size, I like to make that decision in the operating room. So when I get there, I usually have 5 or 6 different pairs of breast implants that are just the right width for you, but have different amounts of volume in them. That lets me be able to have a little bit of visual feedback. So when I get there, I make the space for the implant, and then I put in something called a sizer. Now, a sizer is like a single-use throwaway breast implant that I can put in fluid and get to see what you look like with 200, 300, 400 cc's or anywhere that you might want to be. And then once I get that little bit of visual feedback, I know exactly what you look like with that volume. It lets me be able to make a final decision on the table based on what you've told me. And then I can take that out, I throw that away, and I open up the breast implant that's going to be just perfect for you, and I put that in. We close things up and you look great. So that's how I like to pick implants. Now, there's a couple other decisions that we make about breast augmentation. One of those is where we put the breast implants. Do we put them under chest muscle or do we put them over the muscle? There's advantages and disadvantages to both. And so we can kind of talk through those various options, and then we'll try to help make a decision that's going to be the best one for you. And then finally, we talk about where we place an incision, because we know you're going to have a real small scar when we get finished. It's usually a little less than 2 inches long. And so sometimes that scar can be in various locations. My personal preference most of the time is to put that under the fold. It's a really nice, well-hidden place, and you're hardly ever going to see that scar when it's done. And it gives me really good access so that I can make sure I do a good job making the space to create for your implant. Once we get finished with surgery, surgery takes usually about an hour or so, and then you're in the recovery room for an hour or two until you're awake and you're feeling good. Once you're awake and feeling good, we let you go home that day. And then most people take off of their daily routine for a long weekend or a short week. Usually 4 or 5 days is long enough that you're off of pain pills, you're back to your normal day-to-day activities, and you're back to driving and kind of doing the things that you need to do to be able to function. Now, I do like for you to take 2 weeks off of any exercise. I don't want you to get your heart rate above 100 for that first 2 weeks. And that's important so we can avoid bleeding or other complications that might happen by that increased activity. And then I also want to limit any lifting you do. So I usually put you on about a 10-pound weight limit for the whole first month. After 2 weeks, you can get a little more active if you want. Cardio exercise is fine, but still no heavy lifting with your chest until we get to that 1 month mark. I do like for you to wear a support bra after surgery, and I think that just helps to keep things where we want it to be for that early period of time while everything's getting healed and the scar tissue is getting settled after surgery. Once we get to that 1 month mark, I let you get back to normal. You can ease back into your exercise routine and kind of get back to doing anything else that you want to do. In the long term, I don't want you changing your lifestyle at all because you have breast implants. I want you just to be able to go back to normal, do anything you would have done before and not think about it. I do like to check up on you about 6 months after surgery. I think that's important because the entire process of healing and really having you look like you're going to look in the long term really kind of finishes up about 6 months after. So I like to talk to you one last time, make sure you're feeling great, you're happy with it, and there's no concerns.